You take your blood pressure medication every morning without fail. It sits right beside your coffee cup. You have not skipped a day in 4 years. You are following instructions to the letter, yet something just feels wrong. Your legs seem heavier by the end of the day. There is a persistent cough that will not go away. You get dizzy when you stand up too quickly. You mentioned it at your last checkup, but the doctor just nodded, mentioned the meds are working, noted your numbers are great, and told you to keep it up. So you went home and kept it up. Well, here is what your doctor left out and what this video will fix right now. Those symptoms are not signs of getting sicker. They are your body clearly explaining what the drug is doing internally. Once you learn that language, everything shifts, including the one side effect most people on amlodipine have been blaming on their dentist for years. What 15 years in clinical practice taught me is simple. The blood pressure reading on the monitor is not the whole story, and anyone handed one of these prescriptions without the full context deserves better. If that matters to you, please subscribe, hit like, and turn on the bell. That is how Dr. William Lee reaches 1,000 subscribers. Before we proceed, I need you to do something immediately. Think back to the moment you first noticed a change after you started your blood pressure treatment, not the diagnosis or the numbers, but the physical sensation. Was it exhaustion by midday? A cough that began 6 weeks in? Heavy legs by dinner time? Leave a comment describing exactly how it felt and when it began. I want to construct an accurate picture of what patients on these 3 medications are living with, because that perspective is missing from any medical brochure. Let me begin with the basics, because if you do not grasp how these 3 drugs differ, the rest will not make sense. Amlodipine, Losartan, and lisinopril all appear on the same prescription pads for hypertension. However, that is where the similarities end. These medications reach the same goal through entirely different paths. What happens along those roads inside your blood vessels, kidneys, heart, muscles, and even your mouth is not interchangeable. Amlodipine acts as a calcium channel blocker. Imagine the smooth muscle surrounding every blood vessel as a clenched fist. Calcium is the trigger that makes that fist tighten. Amlodipine prevents calcium from getting into those muscle cells. The fist relaxes, the vessel widens, the pressure drops. It is a simple mechanism, yet the effects ripple throughout your whole body, not just the vessels you are treating. Lisinopril is an ACE inhibitor. ACE stands for angiotensin converting enzyme. Your body creates a chemical known as angiotensin II, which is a signal telling your arteries to tighten. Lisinopril blocks the enzyme that builds that signal. Less angiotensin II means less constriction and lower pressure. But lisinopril impacts the respiratory tract and kidneys in ways that produce side effects that surprise people months, not days, after starting. Losartan is an ARB, an angiotensin receptor blocker. Where lisinopril prevents angiotensin II from being created, losartan allows the body to make it, but blocks the receptors it tries to lock onto. You get the same result, lower pressure, but because of the mechanism, losartan affects potassium regulation in the kidneys in ways that can quietly escalate into a crisis if no one monitors the lab results. 3 different roads, 3 different sets of signals from your body. If nobody provided you with a map, you will spend years misinterpreting those signals. That ends today. Sign number 1, and this issue sends more seniors to urgent care than almost anything else related to these drugs, is swelling of the ankles and legs while on amlodipine. This is not because your heart is failing or your kidneys are struggling, but because of the specific way amlodipine relaxes your vessels. The small arteries at the edges of your body relax faster and more thoroughly than the veins do. More blood flows in than can flow out. Fluid seeps into the surrounding tissue. By 5 p.m., your socks are leaving deep indentations. Your shoes feel like they belong to a smaller person. Your legs feel like they are carrying something extra. Most people on amlodipine who experience this quietly adjust their lives to cope. They stop wearing certain shoes. They stay seated longer than they want to. They start skipping doses on important days because they feel embarrassed. That embarrassment is causing uncontrolled blood pressure on the days when it matters most. The swelling does not mean amlodipine is destroying your body. It is evidence that the mechanism is working more aggressively than your circulation can handle. It is a manageable issue, but only if you have the conversation. If you have been handling this in silence, comment below with how long it has been happening and how it has altered your daily life. Do not just cite a number. Tell me what you have stopped doing because of it. Sign number 2 is often visible for months before people realize what it is. A dry, chronic cough. It is not a cold or allergies. It is a tickle in your throat that appears without warning, often around 2 a.m., and is not helped by throat lozenges, antihistamines, or stacking pillows. Here is the mechanism. Lisinopril blocks the enzyme that breaks down angiotensin II. However, that enzyme also breaks down a substance called bradykinin. When you block the enzyme, bradykinin builds up in your airways. Bradykinin is an inflammatory mediator. It irritates the bronchial lining. Your body reacts by coughing. This happens not because your lungs are sick, but because the medication is doing its work and the bradykinin has nowhere to go. The cough does not always appear in the first or second week. Clinical records show it can emerge 3, 4, or even 5 months into treatment. By then, patients have blamed seasonal allergies, postnasal drip, acid reflux, or just getting older. They get treated for the wrong condition while the real culprit is sitting on their bathroom counter. What I am about to describe in the next sign is the one that almost nobody connects to lisinopril, and it explains a pattern you may have noticed in your body for months without realizing it. Do not skip ahead. Sign number 3 is critical. With lisinopril, a cough is an annoyance. Angioedema is a medical emergency. Angioedema is rapid swelling of the soft tissues, your lips, tongue, face, or throat. It can happen in minutes. If it hits your throat, it constricts your airway. This is not a wait until Monday situation. This requires immediate emergency care right now. The crucial point is that angioedema on ACE inhibitors like lisinopril can happen at any time during treatment, not just at the start. People who have used lisinopril for 2 years without issue have developed angioedema. Clinical reports document cases where it appeared after a dose no different from the hundreds taken previously. If you take lisinopril and notice any swelling of your lips, tongue, or throat, that supersedes everything else I will say today. That is the one that requires immediate action. Before I continue, do this right now. Open your hands with palms up and check the skin between your knuckles and your wrist. Look for any puffiness that seems different from the other hand. Hold that position. I will explain exactly what you are looking for and which medication it relates to in the next 90 seconds. Sign number 4 is potassium imbalance on Losartan and lisinopril, and the most dangerous cases occur in people who thought they were being extremely health conscious. Both drugs interact with how the kidneys manage potassium. They cause potassium retention, leading to rising levels. The medical term is hyperkalemia, too much potassium in your blood. Since potassium regulates the heart's electrical rhythm, this is dangerous. Potassium is not just in supplements. It is found in every salt substitute sold in health stores, the very product marketed to heart-conscious seniors told to lower their sodium. It is in electrolyte powders, it is in potassium-fortified broths and meal replacements. Patients on Losartan or lisinopril who switch to salt substitutes because their doctor advised lowering sodium are unintentionally stacking potassium on top of a drug that is already holding potassium in their body. That puffiness on the back of your hand a moment ago, if you are on Losartan, is exactly what early fluid retention from potassium-related cardiac stress looks like in some people. Unexplained muscle weakness, a fluttering sensation in your chest that comes and goes, tingling in your hands or feet. These are potassium warnings. They frequently occur in the most health-conscious patients, the ones doing everything right, consuming everything they believed was good for them. Here is what most people miss because they stop watching now. The next part explains why patients on Losartan or lisinopril arrive at the ER on a regular Tuesday with a potassium level that demands urgent action. The mechanism behind that number is what I am covering next. You need to hear this. Sign number 5, illness changes everything. This is what hospitalizes the most compliant patients, not the careless ones. Losartan and lisinopril alter pressure dynamics within the kidney's filtration system. Normally, the kidneys compensate. But if you get a stomach bug experiencing 24 hours of vomiting and fever, you become dehydrated. Dehydration reduces blood volume. Lower blood volume changes how significantly these medications affect you. Blood pressure drops lower than it should. The kidneys, already handling the drug's effects, face double the stress. The result is dizziness, weakness, near fainting, and, if no one intervenes, acute kidney strain within hours. Those at highest risk are the ones most proud of their consistency. They have never missed a dose. They are not going to skip one today just because they feel ill. That dedication becomes dangerous when the body's fluid balance shifts. Most people were never given a sick day plan. No one told them, if you cannot keep fluids down for a few hours, call me before you take today's pill. I think of a patient named Clarence. He was 77, retired, and had been on Losartan for 3 years without an issue. He caught a stomach bug on a Thursday. He took his Losartan on Friday morning, just like always. By Friday afternoon, standing up made the room spin. His wife found him hanging onto the counter. In the ER, his blood pressure had bottomed out and his kidney markers were high. Clarence was not negligent. He was simply uninformed about the one scenario that changes the rules. From his hospital bed, he remarked, "No one told me the pill behaves differently when the body is different." That sentence is the void this video aims to fill. I want to know how many of you have been in Clarence's shoes. Think about the last time you had a severe stomach virus or fever that kept you bedridden. Did you take your blood pressure medication as usual? Leave a comment explaining what happened that day, how you felt, and what action you took. Someone watching is handling the same confusion without knowing it. Sign number 6 is the one no one links to amlodipine because no one expects a blood pressure pill to impact the mouth. Gingival overgrowth. The gums start to grow. They thicken and expand over the teeth. Sometimes the tissue bleeds. Published case studies document this in patients taking the standard 5 mg starting dose of amlodipine. In some instances, it did not show up until 4 years into treatment. The mechanism involves amlodipine's impact on gingival fibroblasts, the cells that generate connective tissue in the gums. When calcium channel blockers disrupt normal fibroblast regulation, collagen production speeds up unchecked. The gums grow because the medication altered the signal telling them to stop. People who develop this visit their dentist. The dentist treats it as a periodontal issue, scaling, root planing, sometimes surgery, none of which fixes the root cause. In various published cases, switching from amlodipine to a different medication resulted in significant gum reduction within 30 days without any procedures. If you have been struggling with gum issues since starting amlodipine, you need to have that conversation with your prescribing physician. Sign number 7, over-the-counter pain relievers on Losartan and lisinopril. Ibuprofen and naproxen should not be viewed as harmless drugstore items for anyone on these two medications. NSAIDs, non-steroidal anti-inflammatory drugs, lower blood flow to the kidneys by constricting the vessels that supply them. For someone on Losartan or lisinopril whose kidneys are already adjusting to altered pressure dynamics, that constriction compounds the problem. Add a water pill, which many seniors also take, and you now have 3 mechanisms simultaneously reducing kidney perfusion. Lab results drift. Blood pressure becomes harder to manage. Kidney function degrades slowly without any dramatic symptoms. If you take ibuprofen or naproxen regularly and are on Losartan or lisinopril, that is the next call you need to make. Sign number 8, dizziness, falls, and the myth of the extra dose. These two problems go together because they stem from the same misunderstanding of how these drugs work. Every one of these medications can lower blood pressure more than your body can immediately compensate for. This results in orthostatic hypotension, that 5 to 10 second tilt when you stand up from a chair. For adults over 60, that moment in a bathroom at 3 a.m. is a potential fracture event if the wrong furniture is out of reach. Remember the 30-second rule. Sit on the edge of the bed, feet down, hands on the mattress, for 30 seconds before standing. Write that down tonight. The other side of this is timing and dosing. These medications function by maintaining a steady level in your system. They are not rescue pills for a sudden spike you notice at noon. If you miss a dose and then double up, your blood pressure does not smooth out. It swings. When someone takes an extra dose because a reading looked high before dinner, that extra pill extends the drug's effects into the night when your blood pressure is already naturally dropping. The result is a morning of weakness and unsteadiness that sends people to the ER with symptoms mimicking a cardiac event. If you miss a dose, call your doctor. Do not guess. Do not double up. Now, here is what you do after this video, the medication clarity protocol. 4 steps to start tonight. Step 1, write down the class your medication belongs to. Calcium channel blocker for amlodipine, ACE inhibitor for lisinopril, ARB for losartan. The class dictates the signal pattern and what you need to watch for. Step 2, keep a symptom log. Note the date and what you felt. Not readings, but sensations. Heavy legs, a cough, a dizzy spell, gum changes. This log turns your next appointment from a data exchange into a real conversation. Step 3, if you take Losartan or lisinopril, check every salt substitute and electrolyte product in your kitchen. If potassium chloride is one of the first 2 ingredients, put that product on your list of items to discuss before you keep using it. Step 4, establish your sick day rule now. If you cannot keep fluids down for more than 3 hours, call your doctor before taking your next dose of Losartan or lisinopril. Write that rule by your pill bottle before you go to sleep tonight. What requires an immediate doctor visit? Not on Monday, right now. If you take lisinopril and notice any swelling of the lips, tongue, or throat, that is angioedema. Seek emergency care immediately. If you experience sudden muscle weakness, irregular heartbeat, or numbness across both hands while on Losartan or lisinopril, get same-day labs. If dizziness following a dose change does not subside within a few minutes of sitting, that is a call, not a wait. Everything in this video is for your information and education. Your situation is unique to you. Your other meds, kidney function, and daily habits all influence how these drugs act in your body. Use this as the foundation for a genuine conversation with your doctor, not a replacement for one. If this provided you with something your doctor never took the time to explain, do 3 things before you close this tab. Subscribe to Health Protection so you never miss the next video. Hit the like button so this reaches others managing symptoms they cannot explain, and turn on the notification bell so you are the first to know when the next video releases. That is how Dr. William Lee reaches 1,000 subscribers and how this information continues to reach the people who need it. In the next video, I am covering what happens to these medications as the body changes through your 70s, why a dose that worked at 65 might need to be reevaluated at 72, and what labs your doctor might not be running unless you request them. If you have been on the same dosage for over 3 years, that video is not optional. Before you go, tell me in the comments which of these 8 signs you were experiencing but had never linked to your medication. Do not just write yes or no. Explain how long it has been going on, what it felt like, and what you thought the cause was. That answer helps the next person who finds this video know they are not alone.